Hey everybody, it's July 7th, it's 3 o'clock, it's Tuesday. That means it's Tech Tuesday. I'll be right back. Hey, thanks for joining me and thanks for being here for Tech Tuesday. I'm Rick Hughes, VP Marketing here at Zcorum, where we, every Tuesday at 3 o'clock, we talk about technical kinds of things that apply generally to broadband operators as providing broadband, whether you be a cable operator, telephone company, wireless, whatever. We're here to discuss those kinds of things. A lot of times it impacts the subscribers, the consumers of those services. So again, Tech Tuesday. Today I thought I'd talk about what's happening, kind of what is news right now going on in the broadband industry. I'll do that every now and then. And let's get right to it. So this is a blog post from CableLabs. CableLabs is the organization that has put together the DOCSIS standard for years, for cable operators, and they've got a great blog with information about that. And here's a story about network capacity management using proactive network maintenance. That would be PNM, DOCSIS PNM. That's a solution that the very smart folks at CableLabs came up with to use the pre-EQ data. That's the pre-equalization data that cable modems transmit back to the CMTS to try to determine where there are upstream impairments in the cable network. And they're talking about being able to use that for capacity management. That's very important right now, as cable operators have discovered with COVID-19, a lot of people shifting their patterns, working at home now, and the need to provide more capacity on the cable plant, especially for more hours during the day. This has become more important, capacity planning and management, and PNM is a great tool for that. They say here, you probably know that it's normally about finding and fixing problems before they impact customers, because again, you're looking at this pre-EQ data, and that tells you, well, number one, what pre-EQ does is it doesn't fix the problem, excuse me. It kind of compensates for the problem. It compensates for things like micro-reflections and group delay so that it's not impacting the customer, but the problem's still out there. And with a PNM tool, you can look at that pre-EQ data and try to figure out where that problem is and attack it before it actually starts impacting the customer. So that's the main thing that you do, the one thing that you do with PNM. But what they're saying here is that in addition to that, you can use PNM to increase the capacity of your cable plant. They're talking about here, if severe, the impairment may impact the data carried on those frequencies entirely, leading to correctable and even uncorrectable data errors. So obviously, if you've got uncorrectable code word errors out there, then you're transmitting that data and not all of it's making it there. So you've used some bandwidth, and then you're having to retransmit those packets. So you could have uncorrectable code word errors that are causing you capacity issues, and those are some things that you can correct for. And these kinds of impairments will cause those uncorrectable code word errors. And then you've got also your regular SNMP monitoring tools that can also tell you when you've got code word errors. So in addition to finding the problems that may be causing them through PNM, you've got other tools that will show you, wow, this particular device here has got code word errors, or this whole channel has got code word errors. It talks about, if not severe, profiles may be able to adjust to lower modulation orders to allow less data to be reliably carried than otherwise. Impairments impact the capacity that the operator can get from the access network. So basically what they're saying is this can impact those kinds of things. So you've got code word errors, you've got some other things that you can do in certain monitoring tools is you can look at whether your downstreams and your upstreams are balanced. You can, something else I was thinking, just left me. But there's things that you can do in these tools, and shameless plug, we've got our own DOCSIS PNM tool, pre-equalization analyzer, so you can check that out on our website. Also TrueVision, that's our SNMP monitoring tool. That will help you easily find devices that, and channels that are being impacted by code word errors. Lets you look at partial modems, that was one I forgot. So if you might have some modems that are operating on partial, so where they're not bonding to all the channels, you can easily see which ones in TrueVision are doing that. You can look at which of your MAC domains, the balance between those on your upstreams and your downstreams. So there's lots you can do in these tools. So again, shameless plug, you can just go to our website, check those out, TrueVision, pre-equalization analyzer, if you want to know more about those. Shameless plug over. So there's a lot because of, again, of COVID-19 and just in general rural broadband bandwidth issues, and bandwidth or broadband not being really accessible in rural areas. There's been a lot of talk about that. A lot of it has been highlighted by this COVID-19 pandemic, because we've seen as more people have been home, especially business people that are having to do work over the internet and students that are having to do school over the internet, at least before the summer. This was really impacting some areas that didn't have good broadband. So there are there's lots of money that's to be had, and I've seen a lot of states doing things. We've got, of course, federal dollars that are being considered, some that are already part of plans that I'm going to be talking about, some initiatives that are already out there, some possible stimulus money coming, and then you've got a lot of states that have been announcing things like this. Here, Missouri's announcing $50 million for broadband expansion, and they're including telehealth in that. The expansion will include support for telehealth and libraries, and the governor says that the money will come from the federal CARES Act funding. I don't think they're talking about all $50 million. That would be a lot for the CARES Act. I don't even think they're talking about $5 million that they mentioned here in a minute. They may just be saying that some of the money is coming from CARES for funding telemedicine, telehealth kinds of initiatives. Because they're saying $20 million is going to go to establish a reimbursement program for broadband providers to assist them with construction costs for new broadband expansion to households with students or vulnerable populations. So again, they're trying to aim this at areas that that don't have good broadband, and there's $20 million going towards that. So the project will also provide $5.25 million for telehealth. Again, I don't think all of that's coming from CARES. That will support connectivity for telehealth services for vulnerable populations. The state will partner with the Missouri Telehealth Network to secure about 12,000 hotspots for the state's 29, 2G would be really bad, 29 federally qualified health centers and 26 community mental health centers. So again, there's states that are providing money for cities or EMCs or just other ISPs that are in the area to maybe to provide or to help them expand broadband in those areas. Speaking of the telehealth program and the CARES Act, the CARES Act is nearing completion as far as the telehealth portion of that. The CARES Act is the coronavirus aid, I can't remember what it was. Sorry, I can't remember the acronym, but it's basically to provide relief, aid and relief kind of things for, it could be broadband providers, it could be, if your paycheck was affected by this, certain things, there were certain fields, but there's money that was there for telehealth programs. And the deal with this was that money is going to be available until it runs out or until the pandemic is over. And they've not yet said the pandemic is over. And with the case numbers going like this, it might be a while before they say the pandemic is over. I don't know, I don't know if we're going to get through the first wave, because they're already talking about a second wave, and the second wave is probably going to hit in the fall. Now the good news is deaths have been declining, and the cases have been going up like this for quite a while now, at least 4 weeks, I think, and the deaths still are declining. So it may be that more people, I think they're saying more younger people are getting it, being exposed, plus testing is increased. So fewer deaths, we're probably treating people better, not better, but more effectively in hospitals. So that could be a reason for that. So I don't know if the pandemic will be based on cases, based on hospitalizations, based on the number of deaths. But in any event, when the pandemic is over, this money will be cut off or until it runs out. And they're almost done now with the money. So they're at $189 million out of $200 million that was allocated for this portion of this telehealth here. And you can see here, the reason I don't think the $5 million was all for that particular Missouri initiative is they talk about 3 $1 million winners here. Those are big ones. University of Alabama in Birmingham, BMS Family Health and Wellness in Brooklyn, New York, and Montefiore Medical Center in Bronx, New York. And then it says there's some smaller, really small ones. So this money's still out there. There's only $10 million, only. So, but there's still money out there. You've got Pulaski Clinic in Kentucky was awarded $6,000 or plus for laptop computers and cameras. Southwest Health Center in Platteville, Wisconsin. Again, about the same amount for tablets, video conferencing equipment, and software. So it's still out there, it's still available. This would be mostly going to, could be going to healthcare providers to help them get their broadband connection, a better broadband connection, to buy telehealth or telemedicine devices and software, those kinds of things. So it's still available for now. Thought this was interesting that dentists are considering telehealth. Of course, the money's out there, so that might be one reason they're considering it. So a survey said that they were interested in that. Some 40% of dentists in a recent survey said, this is kind of odd, said they're either using telehealth now to stay in touch with patients or will soon be using telemedicine technology. So that doesn't tell me how many are actually doing it now and how many are interested in doing it and saying they're soon going to be doing it. Because I'm finding, I'm trying to think of how that would be beneficial in most cases. If you've got a doctor, they can talk to their patient, they can diagnose some things by having a conversation with the patient, and it helps to be seeing them face to face and talking to them. And of course, there are some telemedicine devices that will, look down your throat, check your ears, check your eyes, those kinds of things, pulse monitors, whatnot. For the dentist, you could take your web camera, I suppose, and stick it in your mouth. They may have devices that you can put in your mouth to see, maybe where they can check out your teeth. But for the most part, you're going to go to the dentist, hopefully, twice a year, right? You get your teeth cleaned, they prod around in there and see if there's any problems. Basically, they got to look in your mouth and they got to poke around in there to see what's going on. So I'm not sure how much telehealth will be beneficial for dentists, but they're certainly interested in it. And you can see that some of them have, they've just had issues here. Only 57% of those surveyed have remained open for most services during the pandemic, while 31% are only offering emergency care and another 8% have closed completely. So dentists, being as your mouth is open and everybody's concerned about catching stuff one way or the other, you could see why they would have had a higher incident of people canceling. Because a lot of times it's like, well, I can put that off for now. Whereas if you're going to the doctor and you have an issue, you're going to go. And here, obviously, if you have an issue with your teeth, you're going to want to go and you can talk to the dentist, and I suppose they can talk to you and ask you how your tooth is and what kind of pain you have, that kind of thing. I'm just not sure how well that's going to play in dentists' telehealth. And of course, there's a lot of money, never let a crisis go to waste. And there's lots of money that's being thrown around for broadband, really for infrastructure. $1.5 trillion it was a Democrats' bill for infrastructure. But here's a story that says it's doomed. And it is, in a sense, because you've got the Republicans and you've got the Democrats, and are they going to get together on anything without making changes? So in a sense, it is doomed as far as in the state it's in right now. Although House Democrats passed a massive $1.5 trillion infrastructure proposal earlier this week, the Senate didn't take it up before the weekend. And the bill is now facing near certain death, as both top Republicans in the White House have said they will oppose the legislation. So they've come out on the record and said, we're not taking it up in the form it's in. And the Republicans have put forward their own bill. So they've got to get together and do some things. Now, both of them had a good amount of money for broadband. So with both of them having that in there, maybe they can come to some compromises, and the broadband part will go forward, and some of this other stuff that's controversial maybe won't. And they'll go back and forth. Amid near uniform Republican opposition, it's likely the legislation is now officially dead. House Republicans condemned the legislation as partisan, saying that their views were not included in the process, while Democrats said the bill was passed without Republican involvement because they've lost patience waiting for a bipartisan infrastructure deal to materialize. So it's the usual Washington gridlock. Sometimes it's good that there's gridlock, right? Since they're spending money, but we do need better broadband in many areas. There is a concern among Democrats and Republicans strongly oppose the legislation and any future bills like it for including a host of measures aimed at fighting climate change, such as reducing carbon emissions. McConnell, for his part, said he would not bring it to the Senate floor for debate, while President Trump recently criticized the bill as full of wasteful Green New Deal initiatives and indicated that he would veto it. So this particular bill, in the state it's in, is not going anywhere. The so-called infrastructure bill would siphon billions in funding from actual infrastructure to funnel into climate change policies. So again, the climate change stuff is a big deal killer, I think, for the Republicans, because it's trying to sneak in some of the Green New Deal stuff that they're saying should not be in a bill like this. So the House Democrats' $1.5 trillion infrastructure proposal includes more than $300 billion for repairing bridges and roads. You can see this: $100 billion for low income, $100 billion for public transit funding, $100 billion for public housing, $25 billion for clean drinking water, $100 billion for broadband, and then $70 billion for clean energy projects and $25 billion for the U.S. Postal Service. So again, this particular bill is dead on arrival, but that doesn't mean that they're not going to get together between the two bills and negotiate things and hash something out. We'll have to see. Of course, there's still initiatives that are going on that have been in the works for a long time, including the RDOF, that's the Rural Development Opportunity Fund, and they have just recently come out and identified the final list of eligible locations. So when they first announced the list, it was based on data back from June of 2019, and they had said they would be updating that, and there were lots of challenges that came out. So when they announced the list, a lot of providers in certain areas challenged it because they said, hey, you know, since June 2019, we've actually started providing service at the required amount, which is 25 down and 3 megabits per second up. And they've came out and said, hey, we were already providing this now, so you need to take us off the list or that area off the list, and it's in census blocks. The revised list identifies 5,392,530 unserved locations. And again, those are census blocks. And that would mean that anywhere in that census block, not anywhere, there's not at least one place in that census block that receives the minimum 25 megabits per second down and 3 megabits per second up. It's called unserved if there's not a location like that. And the Commission said it granted most of the challenges that showed network operators have begun delivering the voice. It's supposed to be data and voice at 25 by 3 or faster since the June 30, 2019, when the data was actually collected. And it says here that it's probably a lot of the challenges were by WISPs, so these are wireless internet service providers that have come out and said, hey, we're providing service there. And you can see where a WISP could set up much more quickly than maybe a wired broadband operator. So since June of 2019, wireless services have launched in certain areas that had these unserved kinds of areas. Biggest, highest profile challenge to the eligible areas came from Frontier Communications. They came out and had contested 16,000 or so census blocks. And then that challenge was challenged by others who said that's ridiculous. There's no way they have gotten 16,000 census blocks up at that speed in just the time since June 2019, especially since they were going through financial issues. So Frontier now is trying to put a positive spin on that, and they're saying, oh, okay, it's all right, because now that these are going to be in, then that will give us the opportunity to get funds to go ahead and make them 25 by 3. So they're saying, well, now we can go ahead and get support through the USF to be able to provide 25 by 3 in these areas. Now, of course, they have to win the auction. As it mentions right here, they have to have be the lowest bidder for that area, which means providing the least amount of support. And they may have an advantage there because they've got infrastructure there already. If they're already providing service, they'll have to upgrade it. They've already in the areas, they've got an incentive to do that. So they may be the lowest bidder in some of these areas. And by the way, I forgot to mention, if a topic like this or the CARES Act, there's a couple of links down below the video on some things where I did a more extensive Tech Tuesday on just that topic. So if you want to know more about RDOF and that auction or about the CARES Act, then you can go ahead and check out those links. There's a couple of others down there as well. This was interesting. So the state of Georgia, where I live, came out with their broadband map. And you can see here, just based on the colors, where you've got good service around the metro area, Metro Atlanta, different counties around here. Then you've got other areas where you've got almost no service. Thought this was interesting down here. You've got, so you can click, this is the county portion of the map. So you can actually click anywhere in here and look in Fulton County, where Atlanta is located, and you've got 3% unserved. You've got, if you look at, let's see, Henry County, it's saying there's 1% unserved. So there's very few unserved locations in these metro areas. But if you go down to some more rural areas, like a very rural area like Baker, this is very rural, it says it's 100% unserved. So there's nowhere apparently in this county that you can get 25 by 3 service, because they're going by the same definition, 25 by 3. And if I zoom in here, I'll actually go back out again. So I lost it, Baker. If you look at Baker County, Where'd it go? Lost it again. There, Baker. There it is. There's only one town from the looks of it, so it's very rural. Close that. It's a town called Newton, and as I zoom in, I was looking at it on the satellite. Actually, there's not much there. So the folks in this town are probably not getting good broadband, and anywhere in the county. Look like maybe a lot of farm areas, those kinds of things. So Baker County. Now this is an interesting version of the map. They have here on the map where you can overlay the FCC's map of unserved areas. And the difference is, in Georgia, they're saying you have to have at least 80% of the county covered in order for it to be considered served. Whereas with the federal government, there's got to be at least somebody's got to be able to get that service. So here you've got the Georgia map, and if you slide this over, this is Georgia, and then if you slide it over, you can see the federal map and their coverage. So you can see from the federal perspective, it looks like there's a lot more coverage because in some of these counties, it looks like Baker is still left out in the cold, regardless which way you look at it. But a lot of these areas look a little better because there are some locations that are providing, at least in some of these census blocks, where they're providing at least one area at 25 by 3 versus Georgia, where you've got to have 80% of the coverage. So that's the difference in those two maps. And then this is something else that's going on here is the CBRS auction. So CBRS is a band of spectrum in the 3.5 or so gigahertz range, and it's called Citizen Broadband Radio Service, I believe, CBRS. And this is going to be going up for auction, and this is a band that has been mostly, there's some incumbents in there, some WISPs that are in there that have been using it, but they're going to have to get off of that band. A lot of them already have to be off in 2020. And then there's incumbents, mostly the U.S. Navy, where you've got radar, ship radar, where ships are coming in and out of port, those kinds of things. So it's using dynamic spectrum. I believe I've got a link to I have a link to CBRS if you want to know more about that. I did a whole Tech Tuesday on it. So again, 3.5 gigahertz dynamically shared. So there are 3 tiers. There's the incumbents that are in there that are currently some WISPs, but then also once they're grandfathered for now, but once they're out, it's going to be pretty much just U.S. government, Navy installations that are going to be in this incumbent tier, and they're protected from all interference. Then you've got a license tier where people are going to be bidding for licenses, and they're going to be paying for those licenses, and they're going to be protected from the general users, which is unlicensed spectrum throughout the whole spectrum block. So you're going to have unlicensed spectrum that's going to be there, but they can't interfere with these people that pay for licenses or for the incumbents. And there's a system in place that can tell whether you're going to be interfering, and then you have to back off. So again, I did a whole Tech Tuesday about that. It's very interesting how CBRS is going to be working. But there's now 271 people that have qualified to be bidders for this auction, and that includes who you would expect. This is wireless spectrum. So it does include the 3 wireless carriers here that we've got, the main ones, AT&T, T-Mobile, and Verizon, but also cable companies. It mentioned Cox and Tier 2 telcos like Frontier and Windstream, and numerous small carriers. Telcos, small cable companies likely to use the spectrum for fixed wireless services. So even though it's wireless, and you would think of it being mobile with people like AT&T and T-Mobile, a lot of the companies are going to be using it for fixed wireless. And there's if you look at the FCC website, there's a list of people that, the 170 or so that have qualified for that. And you can see there's different kinds of companies on here. You've got Alabama Power, you've got Arctic Slope Telephone, that's up in Alaska, Arctic Slope. So they're on there. Let's see who we got. Big Bend Telecom, are they in Dakota, Oregon? I can't remember. I think it might be Oregon. Cass Cable, know them. Central Valley Telephone, some of these I recognize as being customers or folks that we've talked to in the past. I remember seeing GVTC, no, it wasn't GVTC, it was Guadalupe Valley Electric, so that's an EMC. You've got Hawaiian Electric, so you've got some co-ops in here, cable companies, all kinds of companies that are going to be bidding on the CBRS spectrum to get licensed for that. But again, there's going to be a whole host of unlicensed spectrum available as well. The only issue there is that you have to make sure that you don't interfere with somebody who's already licensed. But the dynamic spectrum sharing allows you to do that in a way that it should work for everybody. And then finally, I want to talk about this. If you're a city and you want to get in the internet, you can look at getting funds through broadband stimulus package or through RDOF, something like that. But another thing that cities are doing is they're starting to look at these public-private kinds of partnerships. And in this case, you've got West Des Moines set to become, it says, Iowa's first Google Fiber city. And I had thought that Google was kind of out of this business, and because it's very expensive for them, because basically they were doing all the work, in a sense, trenching everything, and they had a trenching system where they would trench in the road and not go very deep, and it didn't cost very much, relatively speaking, to do that. But in one of their cities, I think it was in Kentucky, it wasn't working. So they now are and they actually exited that city. So they're actually going a little bit further down, like 6 inches down, when they do this. Or in this particular case, it sounds like the city is going to be providing a lot of that. So here it's more of a partnership. So West Des Moines plans to invest $40 million in a partnership to Google to bring fiber to the city. Whereas before, it was pretty much Google doing all the work. Now they would kind of leverage the city, kind of strong-arm them into getting lots of advantages, for that. Everybody was competing to get Google Fiber there, but in this case, City of Des Moines working with them. Other providers. Now this is where it's interesting. So this is going to be what's called an open access network, and you're seeing a lot more cities do this, where they're not just paying to get in the broadband business and then trying to fund that and then becoming an internet service provider. A lot of them don't want to do that. So they want to get better internet, better broadband for their community, and all of the benefits that come with that for their economic development, smart city initiatives, those kinds of things. They want to do all of that, but they don't necessarily want to be in the internet business. So one way to do that is to build the network and then not be the one that operates it, and to let other ISPs ride over that fiber and provide the service that way. So you're seeing that in these open access networks. So in this case, that's what this looks like, because it says Google Fiber is the first to license for the network. Other providers are expected to be licensed later, creating what city officials envision as universal, high-speed internet access with competitive prices. So that's the advantage that they see for the city and the city's constituents, is that the internet's going to be a better price because you've got not just one provider on this fiber, not even just the city. You've got not just the one ISP like Google out there, but you're going to have others that are going to be able to come in there and market, and they don't have to worry about necessarily all of the infrastructure. Although in this case, it sounds like all that Des Moines is doing is putting in the conduit. So Google's not going to have to do any of their trenching, and I think they're going to be putting in the conduit, from what I was reading here. The provider's speeds of 1 gigabit per second are about 100 times faster than the average broadband connection in the US, and that's true. Again, if you're looking at the RDOF, we're talking about 25 by 3, which is okay. But it's not 100 megabits per second, and it's not a gig. There are some RDOF incentives to be able to provide gigabit service, so everybody's trying to move in that direction. So here it says the city plans to solicit bids for laying the underground conduit that would house the fiber optic cables and begin installations in public rights of way later this year. Now, I was reading this to say that they're going to put the conduit in, and then the provider is going to have to run the fiber through that. The ISP is going to have to run the fiber through that, and then also install the CPE. So it says the 3 basic objectives for the collaboration: we would want to make sure there was a lot of consideration given for digital equality. It needed to go to every single home. We would need an approach that would create sort of an open system that would allow for as much competition as possible. That's the open access. And finally, a system that would be financially sustainable, that had some financial backing to it. So on a monthly basis, Google Fiber would pay the city $2.25 for each household that connects to the network. So that's not very much. So Google will only have to pay $2.25 per month per subscriber. The company would install the CPE at the address. So the city is even hands off on that. So whoever the ISP is going to have the feet on the ground, or a contractor or somebody to go out and do installations, and I'm assuming do maintenance at the home, and probably maintenance I'm thinking if the city is just laying the conduit, it may even have to do the maintenance on some of the fiber equipment. So again, the way it looks is it may be where you've got different ISPs, and they're all going to have their own access equipment, both in their head end and then also obviously the CPE at the customer site. I'm not totally sure about that. I thought I maybe saw where people are going to be running their own fiber. So that's an interesting way to look at it. There are other open access particular sites like Ammon, Idaho, I believe, where they've got a open access system where you've got multiple ISPs, but the multiple ISPs are all sharing the same fiber. The city put in the fiber, and they're all sharing the same fiber. And they even have a particular system where you can switch from one ISP to another just by going to a web page and saying, okay, I want to try this guy now, and it automatically all gets provisioned. This would not be quite as convenient, obviously, if everybody's got different fiber and you've got CPE owned by the ISP, but it'll still be open access. So, and then Google is already advertising this, so if somebody is in that area, they can go ahead and sign up to keep in the loop and find out when that's going to be available. And Google is pitching their service right here. So we're going to be seeing more of this. You're going to be I'm hearing a lot of cities now, again with COVID-19, worried about their community, worried about their citizens being able to get access to internet. Maybe they haven't had good internet. Maybe there's only one ISP there, and there's no incentive for them to upgrade the service if there's no competition. So they're trying to get competition in there, and either they're going to compete and set up their own network and they become the ISP, or they're going to work with others to create this network and then let others be the ISP on top of that. But in either case, the citizens of that city are doing better because they've got upgraded broadband and hopefully more competition, and that drives down prices. So while COVID-19's been a real problem for lots of people in this country and lots of economic hits on that, it's been good for broadband because broadband has been seen now as even more than ever as really a necessary infrastructure, almost more than, I think more so than cable TV. Not electric, because if your electric's out, you generally can't get your internet except on your phone maybe, but it's been seen as a necessary utility, a necessary kind of service throughout this, and more people realize how important broadband is if they're going to be stuck at home. So that's why we talk about it every Tuesday. Broadband's always been important to us. We've been doing this since 1995, since before broadband, when it was just dial-up internet. We've been around. So broadband's important. That's why we do our Tech Tuesdays. So thanks for joining me. If this was interesting to you, give me a thumbs up on the bottom there. Just click on the YouTube on the thumbs up. Go ahead and subscribe if you'd like to see more videos like this. I always try to do the broadband updates once or twice a month. May be doing that more often because a lot's going on. So, and then subscribe to our channel. And when you do, click the little bell. And when you click the bell, you'll be notified when we're live. So thanks a lot, and I will see you next week for another Tech Tuesday. I'll see you then. Bye-bye.